Hi, everyone, and welcome to the first episode of BraveTalk. I'm Dr. Melissa Giglio, and I'm a child clinical psychologist who specializes in working with children with anxiety and ADHD. And I work with families, helping them navigate through treatment for selective mutism, social anxiety disorder, and other kind of parenting things come up.
And I'm Daisy Geddes. I'm an assistant psychologist, and I've been working with Melissa now for 4 years. And I'm so excited that we're finally doing this. We've been talking about this for about a year and a half.
Yep.
So I'm finally got the mics. Here we are, and we're really excited to bring you Brave Talk. We want to talk about stories. We want to share tips with you. We want to share our expertise and all of our experience in working with kind of the extras population and kids with SM. And so we're really happy to be here.
Yes. So Brave Talk is all about growing bravery. That's kind of what we are all about. It's what we focus on. We do it daily in the clinical practice, and we focus on helping people, children mostly, face their fears and grow their confidence. And we do that by working with them directly. We also work with teachers and with caregivers to help them know how to support children who have anxiety that's interfering with their daily life.
And we talk a lot about growing bravery and growing brave muscles. So kind of like any muscle, bravery is a muscle that we are trying to grow for it to get stronger. And we kind of imprint this on our kids. They're growing their brave muscles. They might not be there yet, but we're growing it with them. And whether it be kind of putting up their hand or trying to talk to somebody new that they haven't spoken to before, or trying to find a positive in a really tough day. It's really just about kind of giving it a go, even when it feels scary.
That's exactly right. So we are working together and building our bravery in different ways has really just inspired our partnership and working together, but also just creating this podcast to have this opportunity to reach out to people and answer their questions that they have. And we get sent questions all the time. Our clients ask us questions. And we also have a lot of things that just come up in practice that, Daisy and I both have thought this would be really helpful if somebody else got to hear this. And that's really where this came from, and that we want people to know that progress takes time, but people do improve. We see massive changes in how children interact with the world around them when they have good evidence-based treatment. And there's lots of strategies and things that we could do. And we just want to share this with the broader community.
Yeah, I think as well for us, right, it's been that kind of reach, like how can we get to people that are struggling and don't have access to people that are specialized in this area. And we really want to be able to provide that space to share our expertise, but also to share stories of other people's bravery and kind of highlight, that everyone has bravery to grow. And we're all kind of on this journey of growing our bravery in something, and kind of normalize as well this journey that we're all on.
Yeah. And the more you know, the more you grow and the more you glow. We really want to help everyone feel like they feel this confidence when they're growing and taking on challenges. And it's not about the outcome. It's about the effort. It's about taking the step. It's about stepping outside of your comfort zone, and that being your bravery that is growing.
Totally. Now we've introduced ourselves. Let's talk a little bit about Bravery and Bravery Grows, our beautiful book. I wish we actually had a copy of it here to show you now.
Next time.
But Melissa, why don't you talk to us a little bit about how Bravery Grows came about and kind of the message of the book?
Well, so writing a children's book about growing bravery was something that was always kind of in the back of my mind. And it wasn't until Daisy and I partnered up and the pandemic actually, that we were having difficulty seeing our current patients, and we were getting all these referrals from different places in the world even, and we weren't able to have that reach. And it was just a really tricky time, and we wanted to move it past what we could do and move it more out to how can we teach others the skills and help support families. And our idea was to create a beautiful children's book that anyone would want to have on a shelf in the library, in the classroom, and in your home, where a kid would want to pick it up. And it would have a message that's really for everyone, which is we all have bravery to grow. But it really would be the story of a little girl who doesn't know why her words won't come out and the frustration she feels about it, and what her family says to support her, to help change her mindset, and to really notice the steps of change that happen, all wrapped up in a children's book.
Yeah, I think for us as well, you touched on it, but we really wanted to make something that was really beautiful and kind of accessible and didn't feel like a therapy book, but just, felt like something beautiful that you could have on your bookshelf. And was, even though we talk a lot about it, in the book about kind of finding your brave voice and working on your brave voice coming out, we wanted it to be this kind of applicable underlying story that we all have bravery, that we're growing, and it can apply to kids and be a talking point for kids in any kind of area of difficulty that they're having. I think also you want to talk a little bit about the representation piece as well that we wanted from the book.
Yeah, so I felt like there was a lack of stories that had representation in a story about a child who is able to speak, who is not doing that. And one of the things that we notice when we're working with kids in the classroom is everyone in there knows the child isn't talking. And when we go into the classroom, they're like, why aren't they talking? They don't talk. So it's the elephant in the room. So to have a story that a child can feel there's some representation that also shows the child speaking at home, what they're sharing with their families, and how just plugged in and attuned they are, and then what that difference is, but also how much they want to play and they want to run and they want to be like everybody else. We felt like was really important. Even very thoughtful down to how the child looked, because we wanted it to have this appeal where it was a bit ethnically ambiguous, where this child was from, or, just where they hailed from in general, what they look like, what their mix was, because we wanted kids to be able to see some of themselves in the character. And the other kids in it are also, vast representation, and there'll be characters in other books in the future. So we were really thoughtful because we really wanted kids to feel excited to see a character who had struggles similar to them, but also that may have some similarities with how they look too.
Yeah, I think it's also like from the feedback that we've got been so powerful as a tool in the classroom, just to kind of, as you say, address that elephant in the room that kind of maybe people don't know how to bring up, or if bringing it up is going to be more damaging or cause more harm. It's actually a really nice tool to kind of introduce the other kids to the classroom into what's going on as well, and kind of normalize it in the sense that we all have bravery to grow, and this is just one area of bravery, and in many, whether it be, putting up your hand in class, or riding your bike, or inviting somebody over for a play date. Like, there's many different forms in which this can come across. And I think it's been such a nice tool to introduce it to, this particular issue into the classroom as well, especially for teachers, kind of gives them something that they feel confident in discussing as well.
And I think when we've gone into classrooms and read, every child can bring up something they want to get better in, they want to get stronger in, they want to grow their bravery in. And so that's been really beautiful. And we've had some teachers that will read our book the first week of school, and the children will draw a picture, and then they'll make it into a necklace for them. And that, this is something really special that they get to have, and they see it as a symbol of them being brave and what they're working on. And everybody has it. And that's just what we want kids to know, is everybody has things that we need to work on, bravery we want to grow, things that feel challenging. And that's really important.
Yeah, and I think it's also that growth mindset piece as well, isn't it? It's like that you're not there yet. We're all working on something, and kind of turning that I'm not good at this, or I can't do this, into you're just not there yet. And we're giving it a go, and we're giving it a try. And that, we're growing our brave muscles. And, that is really important for us as well. That kind of bigger growth mindset kind of piece that the book also speaks to.
Yeah. Okay, so a big part of BraveTalk is really raising awareness about selective mutism, or SM. Daisy, do you want to give a brief intro to what SM is for everyone who is watching or listening.
Yeah, so SM is an anxiety disorder, and it's not that children can't speak or aren't able to speak, but it's that they're unable to speak in certain situations. And these situations might differ dramatically from child to child. We always say if you've seen one child with SM, you've seen one child with SM because they all present so differently. But it's that kind of psychoeducational piece where we're trying to educate as well, is that this is really an anxiety disorder and it's not a defiance or not wanting to engage or kind of checking out, but really that kind of freeze response in that fight, flight, or freeze, where the anxiety just kind of floods them and it becomes really hard for them to speak to people in certain situations, whatever the situation might be.
As much as they want to. They just are unable to. It's really about an inability, but not a lack of capability. And I think that's really what we work on in terms of helping shift people's thinking about what SM is. This is a coping mechanism for them that they have somehow found. Again, they haven't planned it out. This is just how it is really exhibited in these environments. And it's typically not until they're in an environment where they're expected to speak, usually separated from their family. So school age is when we get these kids, preschool, school. And that's really when this pops. You see these kids come in. It's very confusing for the parents because they see a different kid at home, and to then see your child struggle in situations and just not be themselves and not play or be able to run to their friends at a birthday party or just leave their parents' side. It's really hard for them to see. And being a parent, you want to support your kid. It's so hard for you to see them struggle, but you're not quite sure how much to push, what to do.
Just make it worse.
Yeah. So, our goal is always to support the families through this process and help them grow their bravery and their distress tolerance of their children's distress in these situations by having everyone feel more confident and capable and know that these changes are possible, and how great everyone feels when we see these little steps of change happening. And again, the rate of progress is different for everyone. It depends where the kid is at and what feels hard and just their general responsiveness at the time when they come in. And progress for all disorders, but especially anxiety, is not linear. It's steps, and it's graduated steps. And we're always kind of reevaluating what's the best way forward. Do we, not take as big a leap? Can we push forward more? This is really where the technique comes in. And this is why sharing some of these techniques and just thinking about how to support these kids is really important and valuable. And that's kind of what we want to create here.
Yeah. And I think one of our favorite phrases is we're getting comfortable being uncomfortable. So we are kind of pushing them out of their comfort zone, and very often their parents out of their comfort zone as well. And just being comfortable with that feeling of being outside of your comfort zone and kind of being able to tolerate that anxiety that comes up. But again, as Melissa said, like, our job is like, how do you, that very delicate balance of finding that line, right? Between pushing a little bit, but not too much that it kind of floods and it becomes overwhelming. And kind of, again, remembering that progress isn't linear, and it's a dance that we do, and every day is different, but we're taking small steps, and also just acknowledging those small steps that the kids take, and acknowledging the bravery, the very small acts of bravery, but still huge acts of bravery for them along the way, so that, they feel motivated by the little things that they're doing to really push through those uncomfortable feelings.
So we really hope that today's episode helps you feel less alone, whether you're a parent or a teacher or a child with anxiety or have a history of SM. It really does start with a step. And one step is really just being more educated on what this disorder is, knowing that you're not alone, and knowing that there are professionals like us who are out there to help and who want to answer questions and develop resources that are useful tools for everyone so that we can see those changes happen. And the beginning of the school year is definitely a great time. And we're about to embark on Selective Mutism Month, which I think is a great time for us also to be talking about this. So all of this is perfectly timed, coincidentally. just how it worked out after the summer. But that's really why we wanted to get started with this is, we really want to be this resource and provide that help to others.
And we also really want this to be a space for you guys to come and ask us questions or give us situations, that you might be having difficulty with, and we can kind of talk through them and kind of look at it from our professional lens and all of this experience that we have, and use it as a space really for you guys to troubleshoot and share ideas and share tips that are really going to help your child progress on their journey to becoming braver and stronger and more resilient. And we just are very excited to be here and to be able to support you along that.
So thank you for joining. Remember, keep growing those brave muscles and celebrate every small step. Every victory is a step of growth in one way or another. And we look forward to being back here again soon. So bye for now.
Bye.